I'm going to present my experiences since we joined the MTR and how we face the challenges and set up the team to the keying in and developing the MTR team in Seberang Jaya. Briefly about Hospital Seberang Jaya. Not moving in. Okay, Hospital Seberang Jaya is a tertiary hospital in mainland side of Penang. It's a main referral hospital for the cluster Seberang Perai, which involves 4 hospitals. Hospital Seberang Jaya itself, Hospital Kepala Batas, Hospital Bukit Mertajam, and Hospital Sungai Bakap. It's located strategically just nearby 2 highway, Kulim Butterworth Highway, and also Northern Plus Highway. So we get a good number of severe trauma cases. It has 400 beds with only 13 ICU beds. Our BOR is always has been more than 100, minimum 110%, at most 130, 140% in the worst case scenario. So this is from website KKM now, which shows the BOR in the of my hospitals. Hospital Kepala Batas seems to have very low ICU bed utilization, but it's not correct figure lah, because most of the ICU beds are not open. So all ICU beds in Pulau Pinang State is fully occupied 100% most of the time. Okay, daily visit to hospital ED Seberang Jaya is about 150. At the quiet times, maybe go up to 300 per day at the busy time. We have 10 emergency physicians. We don't have trauma physician yet. We're going to get one in 2024, I hope. So we only have 2 red zone bays and 4 yellow zone bays. This is a very small ED. A new building is going to be ready by early next year. So at any given time, we have a 4 to 5 red zone patient, and sometimes patient is inappropriately triaged to yellow zone, although it should be red zone, because our beds are full. Okay, this is a proportion of trauma patients visiting monthly for our ED. At any given time, about 17 to 20% of our patients consist of trauma patients, but 10% of trauma patients, or sometimes more, are usually red zone cases. So Seberang Jaya Hospital officially registered as a MTR, part of MTR Collaborating Hospital in 2019. In 2021, April, we start keying in the first case, but the first 2 years, we struggle because we are still learning the flow, we're learning the system. So we have a lot of missing cases. So till date, we have entered 301 cases until June this year. So how we develop the team? Initially, we just have 1 EP and 2 MOs. Now we have grown further. So we form a team consisting of EPs. At least should be more than 1 EP, because if 1 EP cannot, another EP will be there to help. So, and the dedicated medical officers who are interested in trauma, interested in pursuing in emergency medicine masters as a perk. And we dedicated a day. Once a month, we roast a day as a research day. Once a month, sometimes twice a month if cases are a lot. So we dedicated the day only for keying in data. We create a Google form to key in for all the red zone trauma cases. We let them, whoever MO of the shift will key in the patient's name and simple particulars. Then the 2 weeks before the designated date, we start tracing the cases. Our record office is Last year quite efficient, but this year after they partially digitalized, it become less efficient. So we trace cases, and we, by the designated day, we have also have a book. Pengarah has been quite supportive. So we have a dedicated place that on that day to use in our Pengarah's office, I mean the administrative block. So we can use that place to key in all the data. So this is the flow. Red zone trauma cases registered in the Google form. Google case files are traced before the schedules entry, and data entered on the designated day. So there is challenges at the site, the efficiency and error in tracing by record office. It depends who is the person scheduled. Some of them are quite very efficient, some of them slow, some of them trace wrong files. Our sometimes case we trace the patient is correct, but it was a medical admission, so it's not compiled together. So we have some problems tracing the case. On that day, maybe we trace 20 or 30 files, but we end up keying in only 10 or 15 because other cases are wrong case files or wrong correct name, wrong admission, or correct admission, but not same patient. So another one thing, the earliest team which has been keying in, most of them has got into masters, got promoted, transferred out. So out of earlier, we have 5 registered members in the MTR group. Right now, we left with, we have dedicated members, but they are in the process of registering. So 5 or 6 of them. And all of them, only one of them is still officially registered with MTR. Others are still pending, the work in progress. So from the system, we find that frequently data, sometimes we key in towards the end, suddenly something hang as system error, we have to re-enter the whole thing again. Sometimes when we complain about the error to the system, it's not rectified. Sometimes the patient with same number of eyes, same patient come 2 or 3 months later with another MVA, another red zone case. But we cannot enter that case because of it detects a duplicate IC, so it won't allow you to proceed further. And data analyst in my department was Dr. Chow. Unfortunately, from what he has, he don't have a full access to analyze. Plus, we also, I think maybe we need a workshop for data analysts separately so that we can learn how to analyze data. Maybe we need more data analysts. So this is my members. Only one of them are officially registered. Others all are 3 of us, Dr. Chow, me, and Dr. Hani are officially registered with MTR for data entry. Rest of others still work in progress. I think that's all from me. If any questions.